Yep, it is Dr. Payne back in the seat and ready to take your phone calls. 416-870-6400 star 640 on cell. You have pain concerns, you have physical concerns, bring them on. We're here to answer the calls over the next hour till 1 o'clock today. We always look back at some cases that have come across your clinic in the last week or so. What's going on, pal?
We do. Good. How are you, John?
Good, man. I'm all right.
So we do always start the show with some type of a case. I had a case this week which initially seemed like it was going to be non-complicated. It was a gentleman who came in complaining of full spine pain, neck, upper back, and low back. The neck originally started about 3 years ago due to a car accident, actually. A week later, he had a slip and fall accident. And so then he hurt the rest of his spine in that accident. He's gone through the gambit of testing and specialists that he's seen. He's been getting treatment for a long time, trying to get better. Heard the show, figured, you know what, let me go in, let me get a second opinion. Again, based on his history, everything sounded like it was going to be mechanical. And when I say mechanical, I mean just simple muscle joint stuff.
Yep.
And probably, obviously a chronic component. One of the things that I always do, no matter how I'll use the term benign it sounds, I always do my full physical exam, and that full physical exam always includes a complete neurological exam. It's so important. We have so many good tests like MRIs and CAT scans for a lot of issues, but when it comes to neurological stuff, our physical testing is so good, like as healthcare practitioners, that we can pick up a lot of early signs of any type of early neurological disease.
Okay.
And so I start testing his reflexes, and right away I note that his reflexes are what we would call hyperreflexive, which means they're really, really good. And so again, not that big of a deal, but still, you'd like to see normal. You never really want to see diminished, and you never want to really see too good. In between is always a good sign. So right away I note that he's got hyperreflexia everywhere. Then I go on to do another test in the ankles, which is called clonus, which is essentially you take the ankle and you jam it upwards, pointing the toes towards the nose. In a normal person, nothing should happen. In somebody that has something going on either in their spinal cord or in their brain, something more serious, the foot will actually start tapping back at you. It's called clonus. And so sure enough, I do this and I get a few beats of clonus coming back at me. I do it to the other ankle, same thing. Now, that's a good sign. You shouldn't see clonus, but at the very least, if it's bilateral and symmetric, that's a little bit better than just unilateral and not symmetric. Then we move on, and I go up to the upper limb, and there's something that you can test in the hand called Hoffman sign, and it's essentially you would take the middle finger and you slap the nail, and you're looking for if the thumb uncontrollably twitches.
Really?
Yeah.
Hey, that's bizarre stuff.
Very, very common with patients with like multiple sclerosis and things like that. So again, now I've seen enough of this patient to know that, whatever he's got going on is not just simple mechanical pain. This isn't just a simple joint or soft tissue injury. This is something more that's going on. And again, I only saw this person last week, so we've started him on the path of getting him to get the right testing, another neurological consultation, so that we can get to the bottom of what's going on. And there's a couple, well, not a couple, there's more than a couple. There's, there are things that it could be. It could be something like something compressing the spinal cord, something like a cyst, a tumor. It could also be something in the brain itself. It could be something neurodegenerative like a multiple sclerosis. But he just basically sat there and was like, how come no one's ever done this to me? And I didn't even know what to say to him. I just simply said, I don't know how to answer that, because this is something that anybody could have done to you. He's like, well, the place I'm going for therapy, no one there has ever done it. And I was like, I don't know what to tell you. Everybody's trained in this type of stuff. Whether you're a physician, a chiropractor, a physiotherapist, you'd be trained in basic level neurological testing. Yeah. And so unfortunately, this got missed. For his complaint is about 3 years. And so who knows? We'll see what it is. And hopefully it's nothing horrible and it's something more on the benign side that's going to be much easier to treat. But it was very, very sad to see that there's professionals out there that aren't going through everything the way they need to go through it, so that you get the right idea of what's going on with the patient and treat that patient the right way, right? Because I could have looked at that patient and said, yeah, just soft tissue, let's get him in for treatment, because that's oftentimes the bias component. You want to do treatment with people. This is not a person that needs physical therapy or manual therapy. This person needs to be assessed for what's going on either in his spine or his brain. And we know for sure, based on the testing, that it's one of those two areas. And now it's a matter of using the specialized testing to figure it out exactly.
So even though you discovered this, chances of him coming back to your clinic with you are not high?
Not necessarily. Again, it depends on what the cause is. We do have patients, for example, on the therapy side of things who say have things like multiple sclerosis. You're obviously not curing the multiple sclerosis, but there are physical manifestations of any type of disease that, physical therapy or manual therapy can help you to at least manage those things. We have patients with Parkinson's, same thing. You're not treating the Parkinson's, but you are treating the secondary symptoms of the muscular. Another big patient base that we've dealt with is HIV. There's, whenever you have AIDS and stuff, there's a big muscular component that goes along with that. And again, you don't treat necessarily the virus, but you are treating the secondary manifestations of the disease, for sure.
We'll take a quick break. You want to start calling in? We'd love to hear from you this afternoon till 1 o'clock, 416-870-6400. Star 640 on cell, email info@paincarecanada.com. Dr. Payne Show just getting warmed up right here. Talk Radio, AM 640. Get to John in Vaughan. Hey, John, how are you, pal?
I'm good. How are you, sir?
Good. What's your concern?
First of all, big fan. I listen to your show all the time.
Good
Thank
man.
you.
Question is for Dr. Lou. Okay, I've done a lot of testings. I have a lot of pain in my body.
Okay.
Went through colonoscopy, endoscopy. They checked. They said I have H. pylori, but then they treated it. There's a lot of pain. My physician right now, she told me that I have gas problems.
Okay.
But and plus I'm a smoker. So right now it's so bad that I can barely stand up to shave.
And this is pain in your abdomen?
My abdomen in the lower area.
Okay.
She gave me some pills before for gas, but then it felt like it's moving gas around in my body and in my heart area. I couldn't even move. Like for a few seconds, I would have to freeze because the pain was getting so bad. So I stopped those pills. It's been like this for I don't know about 6-7 months, but right now it's getting really worse.
Did anything happen? Sorry?
I was thinking of going to the emergency tonight, just sit there and get some testings done, but I don't know what to tell them.
Okay, so let's start with 6 or 7 months ago. Did anything happen out of the ordinary?
No, it's just my back has started. I felt like my spine is hurting, and then my chest has been. I felt like this burning and pain sensation in there.
Okay.
So then I thought maybe because I smoke, that's what it is. But then did some testings. They said it's not that. It could be just gas. But then now it's so bad that it's interfering with my work, with my life.
Okay. So then your doctor has gone through testing to look for more serious issues, obviously, in the abdomen and chest. Is that right?
I just did H. pylori breath test. It came back negative.
Okay.
I did an X-ray.
Of?
I don't think anything came back on X-ray because she hasn't called me yet.
Okay. Where was the X-ray? In your abdomen or your chest?
Well, I think it was for lumbar, but they did it through my abdomen. I don't know.
Okay. Yeah. Fair enough. Yeah, I mean, again, if you've listened to the show a lot, you would know that it's going to be really hard for me to know exactly what's going on. Yeah. What I could tell you is that, again, one of the important things in the management of our public healthcare system is understanding when you should use the right intervention. So is this an emergency? Likely not, right? So you're going to go sit there. The job of an emergency room is to determine, do you have something that's imminently dangerous to you that could potentially end your life within the foreseeable future? And if the answer to that is no, they're just going to dismiss you, likely without a specific answer, because it's not their job to look for the specific answer, because a lot of times the specific answer to these types of issues takes a lot more steps to get to. It's not just as easy as saying, yep, here it is, right? So they would look at you. They may run some testing, especially if you complain of chest pain. They would look at your heart, determine, is your heart, at any risk of a heart attack right now, things like that. They may do some standard blood work. As long as everything looks good, they'll likely just say, follow up with your family doctor or whomever you see, and get it tested from there. What I can tell you, John, is if you're interested, we can definitely try to get you into the clinic. I can try to see you. We can try to go through what's going on, and then I can make some more specific recommendations from that point. Do I think you likely need to go to an emergency room? Again, an emergency room is for emergencies, and if you've been living with this and dealing with it for 7 months, I don't know that that's the best place to be walking into, because likely if it's not imminent danger to you, they'll just dismiss you and send you back home with probably no answer as to what's going on. Does that make sense?
The only reason why I was thinking of emergency is because I felt like I wasn't getting help at this time. I'm just living with this pain. And
so who have you seen? Just your family doctor?
Just my family doctor.
Yeah, so there's other options. So if you're interested, we can try to help you.
Yeah, absolutely.
Yeah, and so there is help. So let's try to get you in for an assessment, see what's going on, and then either me or someone from my team we can point you in the right direction. And again, it was funny because John and I, just before you called in, we were talking about how oftentimes things like, say, a chest pain. Obviously, if you have a patient that complains of chest pain, you would want to rule out anything more serious to do with the heart, obviously, and the lungs, things that are vital organs. But a lot of the times, once those things have been ruled out, people tend to live with pain, and they're really like, but I don't know what's going on. I have this pain in my chest, and my heart's been ruled to be healthy, my lungs are healthy, so what could it be? A lot of the times, visceral type of pain or pseudo-visceral pain is often due to muscular and joint issues that can refer pain to those areas. And that's often dismissed because it's just not a quantity of life question, because it may not kill you, but it will affect the quality of your life, such as John is saying here. So yeah, again, John, come give us a call and let's book an assessment. Take
John,
a look
that
at
number,
it.
1-855-55 Dr. Lou, DRLOU, 1-855-55 Dr. Lou. You want to call in? We got some time here on the radio station till 1 o'clock, 416-870-6400 star 640 on cell. Dr. Payne Show, Talk Radio, AM 640. 1223, Dr. Payne Show. Yeah, give us a call here at the radio station. We have wide open lines. Our call screener, Tom, sitting there bored. He's on Amazon looking what he can get for his Prime that he pays for every month. 416-870-6400 star 640 on cell. You mentioned it just before we ended the break, and that is referral pain. It can really be a scary thing if you don't know what it is, right? You think you're having a heart attack.
Yeah, for sure. Well, referral pain is essentially the best example that most people understand of referral pain is the arm pain that's associated with a heart attack.
The left arm tingle.
The left arm tingle, exactly. And so a lot of things cause referral pains, and referral pains in any muscle can potentially exist. And that just happens to be the referral pattern of the heart muscle itself. And so, yeah, you can have other things. And in fact, on the other end, conversely, you can have vital organs and viscera that seem like it's muscular pain, right? So things like the liver, the gallbladder have been known to refer into the right shoulder. So people, so people don't know. They're looking at a shoulder pain issue and they're thinking it's just shoulder pain. Could be something else. That's where somebody that's well versed in pain management understands the relationship between the viscera and the muscle and the potential cross referral patterns that exist. So that when you're looking at someone, because anyone that I look at with shoulder pain, I'm going to start asking some questions to, at the very least, identify, could this potentially be a visceral type of issue? And if so, I want to tailor my exam to also assess those things. That way we can rule it out. And same thing on the other side, like we were just talking about with the person that just called, abdominal issues. Yeah, you want to make sure that it's nothing within the abdomen itself before you jump to muscle, obviously. And that's kind of the right differential diagnostic procedures to look at things that are most concerning, and then as you eliminate those, get to the things that are least concerning, because again, those would be more a question of quality of life versus quantity of life. So as an example, in the abdomen, you don't want to just jump to, it's a referral pattern from your abdomen or something, like the actual muscles. One of the things that's actually quite common is males with testicular pain can often, and again, when you have a male with testicular pain, you want to rule out the more serious things, especially between the ages of like 19 to 30-ish. Testicular cancer does tend to be more common in those ages. But another thing that often causes it, and groin issues in general, is trigger points in the external obliques that can refer down that low. And a lot of the patients that we get just simply have trigger points. And again, you're ruling out the more serious things because, of course, you have to make sure that the person's health is fine, but then you can treat those secondary things. And I've had people that have come in with things like that, they have testicular pain and they've been checked, everything's fine, but there's pain in that area and they're thinking it's local. And then as soon as I go into the external oblique and you find the trigger point, and as soon as you press on it, they can feel that referral again. And so, from that standpoint, then you treat where the area of the problem is, not just where you're feeling the symptom, because if you were working just in the groin, you wouldn't be solving that issue. You actually have to go after the trigger point.
416-870-6400, star 640 on cell. It'll work the other way, too. For instance, if you have some sort of pinched nerve or something, say in the lower mid-back thoracic area, and you've been having intestinal or bowel concerns, you think, you're thinking right away you've got some sort of disease, but it might not be. It might be just a nerve thing, yeah?
Well, especially when you look at understanding where nerves are coming from in the spine is very important. So the nerves that come out of the neck area, the cervical area, go into the upper limb, and the ones that come out of the lumbar low back go into the lower limb. But the thoracic area, that supplies the vital organs, right? So sometimes even things like disc herniations in the thoracic spine, which are more rare than they would be in the low back and the neck, have these weird types of symptoms that are often associated with them, where they're more symptoms related to GI issues. So people, it's not uncommon to hear somebody complain of abdominal pain with nausea and vomiting. That nerve is irritated, that's going to that area. And so you're getting the same symptoms that you would get in that area if something else was causing that irritation. So absolutely, when you're looking at that area, it is something to want to consider. Thoracic disc herniations don't present like typical cervical spine and lumbar disc herniations, where everybody knows about the sciatica and everybody knows about the pain in their arm from a disc herniation, and that seems to be more commonplace. But the thoracic area, that's a little bit tougher, and it can oftentimes present in more of a visceral type of pattern.
And you mentioned the GI tract is a weird one, and I know this from experience. And once you have some, it doesn't even have to be years, but a few weeks or months of ongoing issues there, that's when the mind gets into play too, right? And you've talked about that so much as well.
Yeah,
it becomes, a Pavlovian response
that's
after
right.
a while.
Yeah, and so one of the big things with the gut area is that there's a high innervation of nerves in that area, specifically the parasympathetic system, which is, we often hear about the sympathetic system, which is our fight or flight response, and the parasympathetic is the area that makes us relax, our neurological system that makes us do. Right now, there's a lot of parasympathetic going on between you and I. We're just
we're
relaxed.
Good like that.
Yeah, we're not. Yeah, versus there's not a tiger at the door and we're freaking out. But there's high nerve innervation in the gut and the abdomen, and so a lot of the times, even with a lot of gut issues, whether it's something that has some type of a clinical finding like a celiac disease, stress always seems to play a big role because of how highly innervated it is with nerves. And so oftentimes one of the wastebasket terms, once we've ruled out everything in the abdomen and we're left with, okay, we know the person has abdominal issues, we don't know what to call it, we call it irritable bowel syndrome.
IBS.
And all that, and that's similar to calling like pain in the body fibromyalgia. You're just putting a really smart term on it. All it really means is that your stress levels could potentially be affecting your bowel and creating those types of symptoms. So it's very, very important. Stress is a huge, huge part of anything for sure.
We'll take a short one. You want to call through, got some issues, pain management, all of it, give us a call. You have about a half hour to do so. We've got some open lines. 416-870-6400, star 640 on cell. And you can email anytime, info@paincarecanada.com. Dr. Pain Show, Talk Radio, AM 640. It is 12:31. Yeah, your phone calls, 416-870-6400, star 640 on cell. Something we've kind of neglected to mention of late, and that is the consultation at the clinic. Yeah,
that's right. Yeah, so anyone, because a lot of people, you may be shy to call the radio show and speak on live radio, obviously. But if you call the 1-855-55-Dr. Lou number and you hit option 2 is a voicemail that gets left specifically for me, and I will do my best to return most calls as soon as possible, no later than 48 hours. And what that is a free consultation. I can have a discussion with you about whatever's going on, figure out what the next steps could potentially be, and that's available to anybody listening, to anybody that, if you know somebody needs it, please, I get lots of calls every week. I'm happy to take more, and at the very least try to point people in the right direction. So just call the 1-855-55-Dr. Lou number, hit option 2, leave me a voicemail, and I'll get back to you for sure.
In the meantime, we'd love to get you on the air here like Frank up in Concord. Hey, Frank, good afternoon.
Oh, good afternoon. How's it going, John?
Good. What's going on with you?
I yell at you sometimes on the Carrasco show.
Beautiful. Keep yelling. We love it, pal. We love it. What's going on with you?
I have a problem where even if I get out of my car to go into a shopping mall, within 20 yards, I have a pain about 2 inches from my left shoulder, from my neck to the left shoulder, thing, whatever it is. And I can't jog, I can't walk, just from this pain. And I'm probably about 80 pounds overweight.
Okay.
I don't know if that has anything to do with it.
Okay, so is that 80 pounds overweight something that's relatively new, or it's been long term?
No, it doesn't have. I don't have any other effects. Just trying to walk. Trying to do my 30 minutes a day.
Okay. How old are you, Frank?
Get the sharp pain. 58.
58. Okay, and this started when?
It's been at least a year.
At least a year. Did something happen a year ago that you can remember?
No. I used to play hockey in the past, but this is nothing that happened.
And so,
I'm a mechanic.
Okay, yeah.
I'm bending over, but I don't think that has anything to do with it. That's more with my back. But
sure. And I had a question, and now it slipped my mind. Well, okay, we'll get back to it when it comes back. But
it's about 2 inches from my neck to the left.
Okay, and it only bothers you when you walk?
Only when I walk.
Okay, so there's a couple things.
Long, maybe less than 40 yards.
It starts right away.
Okay, are you a smoker at all?
No.
Any coughing, any problems like that, or just shortness of breath, or just pain?
Yeah, some shortness of breath, maybe a little bit too much drinking, but no smoking.
Okay. So
and no drugs.
Yeah, okay. So when I hear that, the things that I'd want to make sure is anytime there's a shortness of breath and pain in the shoulder area, we're talking about referral patterns. Lung issues can cause pain into the shoulder, for sure. It's not uncommon. So that would be one thing to consider. Is there, some type of a lung issue happening potentially, and that's causing the pain? Because then the reason why you'd be feeling good with walking is because you get exhausted, right? And so your lung gets a little bit more tired. The other thing it could be is just simple mechanical stuff. Oftentimes what can happen over years, again, because, it doesn't just happen on one day. But if you have something like a shorter leg on one side than another, that means one area of your body is taking on more force than other areas are. And sometimes what happens in the body is it just gets to a point where it's the final straw. And so now you start developing pain in that area. But again, those are things that we would have to obviously look at to be sure. So from my end, just hearing this over the phone call, I would think either some type of a lung issue. It doesn't really, and not even, I'm not even, saying that that's the more likely cause. It probably is more mechanical in nature.
That's what I'm thinking. I'm not a doctor. I go see a chiropractor, and I mentioned that.
Okay.
And, he's squeezing and pinching and all that. But he didn't see anything with the nerve or anything.
Okay. Well, Frank, if you're interested and you'd like to do an assessment, we could set that up just so you can get a second opinion from me. We can try to look at exactly what might be causing that for sure, because I think that would be the most logical next step.
That'll be great. I got
awesome.
your number.
Okay, Frank.
There's a guy, he's a mechanic, so chances are he's wearing work boots. He's bending, he's twisting, he's standing on concrete. He says he's got some weight
physical
issues.
labor,
and
for
he's
sure.
late 50s, right?
Yeah. It does sound
things, right?
very, very mechanical, but again, I'm trying to take people through my process of thinking. And the other thing that I would consider there is a lung potential issue.
Really?
The other thing is being in a mechanic shop. There's a lot of chemicals in there. So even though he's not a smoker,
all kinds of stuff.
There's other things that could be happening. And so you just would want to make sure. We've had cases where this was an interesting case once that it was an incidental finding. They had the person had shoulder pain due to a work accident. They hurt their shoulder at work. And so the shoulder wasn't really getting better. And he was kind of saying, sometimes the shoulder would hurt before the accident, but it was a different pain. So somebody in my clinic decided to send him for an x-ray, sent him for a shoulder x-ray. On shoulder x-rays, you can see a little bit of the lung.
Oh, yeah.
Sure enough, what was noticed in the lung? A tumor. And he had no symptoms besides a little bit of shoulder pain. Wow. And so, and not to scare anybody listening, like, what's rare is rare and what's common is common. And definitely these things are rare. But when you do hear that type of presentation, like we just heard from Frank, I would want to consider, could it potentially be a lung issue? Because again, going back to the diagnostic skill, let's rule out the most serious and deal with the most benign.
Hey, Robert, we'll take it before a break here. How are you?
I'm good. How are you guys doing?
Good. What's your concern?
Yeah, I'm calling on behalf of my dad. He is, unfortunately, on his way out. He's a stage 4 lung cancer patient, and also going through the stages of vascular dementia. Now, what we're dealing with is we're finding that he is complaining of pain in the kind of sort of in the center of his spine. What we think this is from, because he's not very mobile now, and when he is, he's very hunched over. So we're wondering if that's creating a tension that's causing that pain kind of in the center of the spine on his back.
Yeah. So first off, I'm sorry to hear about that. It's obviously very hard for anybody to go through those types of things. One of the things with stage 4 cancer, and especially in the lungs, is a place that cancer often will spread to is the bone. It will metastasize to the bone. When that happens, your bones are at greater risk of fractures. Right. And so he may be developing what's called compression fractures, which is essentially when the bone itself, the vertebrae, collapses. And when it's metastasized, then it's and the bone itself is pathological. It doesn't need to be any severe trauma that can do that. Even just taking a step that's a little too hard can cause those types of things. So that might be a potential. It might also be, again, a complication of everything that he's probably going through. It's very common when you get to that stage to develop a lot of pain complexes due to pathological causes, but I would definitely say with stage 4, with it being lung cancer, one of the things that I would potentially consider in that scenario is that maybe the cancer is now metastasized to the spine, and that pathology in the spine is making it easier for it to fracture in certain areas.
Right.
Yeah. Okay.
Appreciate it, Robert. We'll take a short break. Got some time to call through. 416-870-6400 star 640 on cell. It's 1240 here. Right till 1 o'clock is where we'll go. The Dr. Payne Show, Talk Radio, AM 640. 416-870-6400 star 640 on cell is the number. It is 1244. To 1 o'clock we go. Carmela?
Yes.
Hi, how are you?
I'm good, thanks.
Okay, what's your concern? Go ahead.
Good afternoon. Thank you for taking my call.
No worries.
I'm calling for my dad. There's a number of issues going on. First, I must say that he suffers from asthma.
Okay.
So he's on puffers and what's the other thing he takes? He's on puffers, all right? And he had a white coating on his tongue, which made me believe that it was like a yeast infection. Mm-hmm. I put him on probiotics. That cleared up. However, he's got eyes that always tears. He can't breathe through his nose.
Okay.
And he always looks bloated, and his stomach looks bloated. And it's not like he is a big man, but it's not like he's overweight. He just looks bloated and puffy.
Is this relatively all new, Carmela?
It's been going on for a couple of years now, but it seems to be getting worse.
Has he been checked out at all?
He has a respirologist he goes to see.
Okay.
The family doctor every 2 months.
Okay, and what have they said?
He's also diabetic.
Oh, he's also diabetic. Okay.
Diabetic, yes.
Yeah.
And I just see the problem worsening rather than getting better. And I'm wondering if there's something that is really quite simple that's causing this. And to me, all I keep thinking is maybe a yeast overgrowth. And if it's that, how do we go about detecting it?
Yeah, I'm not really sure it is that. The unfortunate part with any like lung disease, how old is your dad now?
He's 83, and actually it's been 2 months now, and he's had lung x-rays. Mm-hmm. Just having a team of dogs hanging off his shoulder. That's how painful it is.
I missed the last part. I heard
you cut out there for a second.
There's a call coming in. He's saying that he's been having pain in his shoulder, but he's had chest x-rays.
Yeah, okay.
And that hasn't shown anything ominous, so...
Has he had a CAT scan?
No.
Okay. So usually the gold standard with anybody with lung disease type of stuff, and I know this stuff well because my mom has COPD, and I work closely with her respirologist to try to manage it. You would want to get things can be missed on X-ray for sure. It's not the gold standard. So a CAT scan would be.
The call keeps coming in.
Yeah, the CAT scan would be, I think, the gold standard to go at and try to figure out what's going on. The unfortunate reality about most lung pathology is that you can try to slow down the progression, but oftentimes it gets worse with time, obviously. And the other thing is with the diabetes. Is the diabetes controlled well?
It's controlled, yeah.
Okay, so what are his averages like? Like, is he...
Well, it could be better, but he fluctuates from 7 to 10.
Yeah, so that's not very well controlled, right? So that's very dangerous when you have high blood sugar levels. That's corrosive to a lot of things in the body, including the nerves. And so that may be a component of it all. That can lead to other vascular issues, such as you're saying, when people start to develop swelling, it can happen in their abdomen and other places. It's often a sign of some type of a congestive heart failure, like things are starting to become tougher for the heart to work.
Right.
And it sounds like there's like a complex case going on here.
Yeah.
But I would definitely say the next logical step, in my opinion, would be a CAT scan of the lungs to look at those types of things. And again, ruling out the most serious potential causes and not necessarily, like, I'm not really sure the yeast, what that could be. I've never really heard of anything like that.
Okay.
So, I would say that it's probably the complications of everything going on. And, one of the things that he could do right off the bat is try to get that blood sugar under control, which means cutting out, the sugary stuff in his diet is going to be very, very important.
Okay, wonderful. Well,
Okay.
Thank you for your advice.
No problem.
Thank you, Carmela. We'll squeeze in Shane here before we break. Hey, Shane, hello.
Hi.
What's your concern, Shane?
My mother just came from PEI. She found out 2 weeks ago that she has stage 4 lung cancer. It's obviously inoperable.
Mm-hmm.
And we have family that lives close to Oshawa, so they want her to stay there for now until she sees a doctor to find out whether or not she'll be staying in the hospital. But I thought maybe like Princess Margaret would be better, and I was just curious if you know anything about like the treatment and the doctors. I believe it's called Lakeridge Hospital in Oshawa, and I was just wondering, would there be a preference like St. Margaret's or Princess Margaret's or the hospital in Oshawa?
I don't know anything specifically about the hospital in Oshawa. Obviously, the University Health Network hospitals are some of the best here in Canada, let alone the world, right? So the one thing that I can tell you for sure is I think those better treatment centers are often more important when something, again, is more treatable. The unfortunate reality about what you're saying is if it's stage 4 and it's been determined to be inoperable, a lot of the treatment going forward is just more about comfort for the patient. And so, I think any hospital would be suited to do that. But I would encourage you to do your own research on that. I'm not really sure about the one in Oshawa. I know really nothing about it, so I don't want to comment on that. But obviously, University Health Network hospitals, they're great. There's nothing better that we have here. So if that's an option and you think, and again, you make, as a consumer, you make that informed decision that you would prefer to have your mom there, then, it's also a discussion with her doctors and whoever the treating oncologist is and those things to figure out what is the best facility for her to be at.
Yes, because she has appointments with a bunch of doctors coming up next week, all in Oshawa. Like, she's gotten here and saw the family doctor right away, so he's referred, I guess, her out there. So maybe I could see what they have to say.
Sure, yeah. And I know most hospitals, like hospitals know their strengths and their weaknesses, because not every hospital is good for cancer. Not everyone is good for heart issues and things like that. They will refer to where they feel is best. So if you're speaking to someone and they feel that your mom being down in Toronto at one of the University Health Network's hospitals is better, I likely think they would probably make that recommendation. So yeah, I encourage you just speak with them and see what they have to say and make an informed decision with you, your mom, and whoever. But good luck with everything.
Appreciate the call, Shane. We'll take a short break. 416-870-6400, star 640 on cell. Few minutes to go here. You want to get a call in, this would be the time to do it. The Dr. Payne Show right till 1 o'clock. Talk Radio AM 640. Free consultations indeed when you call that number. Email as well, info@paincarecanada.com, as you just said. A few moments left here, 416-870-6400, star 640 on your cell. Jay, good afternoon.
Yeah, good afternoon.
What is happening?
My problem is related to my bowels.
Mm-hmm.
I got large bowels movement, but they're I can't determine when I'm going to go to the washroom. I eat good foods night and day, and I could go first thing in the morning or late in the day. If I'm out doing shopping or something, then it's embarrassing. It's very difficult for me to move quick enough to make a washroom. And I guess the biggest thing I can tell you with this bowel problem is that it's considered bowel syndrome.
IBS.
Of some sort. And anything you guys can do so I could kind of signal my head that it's going to happen within the next 15 minutes, or control it through my eating habits. I'm trying to get it in quickly. My eating different foods, different kinds, whatever. But nothing seems to work. And this has been going on for a few years, and it kind of spoils my day because I can't seem to plan for it at all.
Mm-hmm. So for sure, if it's been determined to be something like an irritable bowel syndrome, then oftentimes, like I was saying, the stress component is a big component. So we have to remember that treatment for a lot of issues doesn't just include the physical treatment. So there's probably not a lot that can be done from a physical perspective, like whether you change your foods and things like that. Because if it's caused by something like stress, then maybe working with a psychologist may be the next best logical step, so that you can try to control the stress levels, do some cognitive behavior therapy. And again, I'm not a psychologist, but these are the types of things that I would recommend for something like this.
It does work.
That you go out there and you get the mind treated, because whatever's happening in the mind is having an effect on the rest of your body. And so again, going back to where we started the show with, if there's a problem in the shoulder, but it's coming from the liver, well, you don't treat the shoulder, you treat the liver. We got to understand that the mind is the same thing. It's just another organ that we have. And if the problem may potentially be coming from the mind, we got to treat the mind. And the best way to do that is with some type of psychological intervention.
Well, I think that's very, very good. And I'll stress that with my wife.
Okay.
She's a beautiful lady, love her and all that kind of stuff, but she's difficult to live with.
So okay,
that's married life, brother.
Yeah, you need a psychologist and a social worker, relationship counselor.
It's so true what he said. Once it may have manifested just as a physical problem, but after a while, now the stress of him, I can't go out. How can I go out? Right away, you're triggering it.
Exactly. And what is that? That's psychological.
You bet.
It's a negative feedback loop where there's nothing ever to stop it. And so now I've had people who one just reminds me of something else. Patient had developed like a vertigo, and it was really affecting him when he was driving. Vertigo's gotten totally better, but he's still sometimes with certain areas afraid to drive. And what is that? That's psychological, right? You have to be able to get over that. And, one of the things, again, is the cognitive behavior therapy. And you have to try to introduce...
Dive in there with it.
Exactly. Yeah. And so a lot of these issues, it's a thing I recommend a lot with people that I deal with chronic pain issues, fibromyalgia, is they're not treating their minds. They're so worried about how do I treat my body? How do I treat my body? It's like your body's not the problem anymore. Right now, and again, we just have to look at the mind as another organ. We wouldn't find it strange if someone said, "Oh, your arm pain is from your neck. I'm going to treat your neck." So you'd say, "Yeah, okay, no problem." It makes logical sense. But somehow, if we say it's your mind, that organ is the problem. It's like, whoa, we have to get over that stigma and really understand how important the mind is in everything, including pain management.
Back in here next weekend. Looking forward to it. In the meantime, the number 1-855-55 Dr. Lou, DRLOU, 1-855-55 Dr. Lou. Book your free consultation. Get in, see the doctor. It is info@paincarecanada.com through email. The Dr. Pain Show. Till next weekend. Talk Radio, AM 640.